thank you for your whole mission with trust-driven care. And it's such a great software. I mean, we haven't even really cracked the surface on all of the things that software can do. And it's already made such a big difference for my staff and the patient experience.
Hey, everybody. Welcome back to another episode of the Trust Driven Podcast. I'm your host, as always, Dr. Josh Satterlee, and it's my pleasure today to be joined by Dr. Rachel Kohl. Dr. Rachel, how are you doing today?
I'm doing well. How are you?
I'm great. Thank you so much for joining us. Now, Rachel, you are an acupuncturist and a fellow, I don't know if we want to say vegan. You live in Las Vegas like I do.
Yeah. A fellow native, as we would say here.
Yeah. Native in Las Vegas terms is if you've lived here more than 10 years. You may as well have been born here.
Although in my case, I was born here.
Oh, well, I wasn't. Yeah. I was born in Southern California, but almost been here 20 years.
Anybody that stays longer than 10 years, that's a long time for Las Vegas.
Yeah, that's right. Rachel, you came to one of our live events. We're our first local user of our software and whatnot. What I want to talk about today is, man, I stopped by your clinic and you guys have built you've got to be the largest acupuncture clinic in the entire state of Nevada, right?
I'm not sure. At this point, we definitely were the first group acupuncture practice in Nevada that I'm aware of, certainly in Las Vegas. But over the last few years, there have been a couple other ones that have popped up now where they've got more than one doc. Because by and large, in our industry for acupuncture, I mean, something like 90% of practitioners are a solo practitioner, alone in their office. So we were kind of unique in that regard.
It's very similar in chiropractic, like a very large portion, probably 80% are solo providers in their office. Maybe they have 2 or 3 staff members, but that's usually what it is too.
Yeah.
So I wanted to dive in too, because you were native and you went into what would I say? You've been on the forefront of your industry as it's grown legs in our state too, right? Like you've been part of making laws and directing the state on what to do. And you've served, do I remember right? You served on the board of acupuncture for the state? My
husband has been serving on the board for, I think, 7 or 8 years now. Yeah. I had formerly been the president of one of the associations. That's probably what you're remembering. Yeah. And then we both have taught at the acupuncture school that's here in Las Vegas. It's the only one in the state of Nevada. Yeah. And we've built coalitions over the years when legislative things have popped up. It seems like there's kind of a core group of us that sort of help spearhead those efforts and just trying to make it more accessible for patients and make our laws here in Nevada make sense and be more in line with the national standards for things so that it's not so hard to get licensed here. Yeah.
Well, I think this is a great discussion point because, this podcast works to talk about trust and where we find trust, whether it's financial things or with patients but one of the things I think that's very interesting to me is, let me give some context to our listeners. The state of Nevada is very small. Essentially, it's Las Vegas is our big, what do you want to call it, flagship city in the very southern tip of the state. And our capital is Carson City, which is essentially in the greater Reno area at the northern part of the state. In between those two, if you drive it, if you go to it, is basically wide open desert where it's so wide open, the government tests bombs up there. Like they can explode bombs and no one ever knows that they did it because it's so wide open. But in doing so, what's also always amazing to me is it's a perfect picture of how like a few people getting involved really can shift a healthcare in the state, right? Like change the scope, change the licensing procedures, change everything. I grew up in California and I always think like, I don't care how long I'd be a chiropractor in California, the chance of me being on the board is close to zero, right?
Right.
And certainly getting support from our senator or from congressmen to change a lot at the national level. You and I can basically walk into our reps' offices and get an audience. Can't do that in California,
Yeah, it's true. And in Nevada for our industry with acupuncture, Nevada was actually the very first state to license the profession of acupuncture in the U.S. back in 1973. So very cool history for us here. But unfortunately, there was sort of a group of people that were on the board initially that kind of wanted to close the door behind them. So they did this amazing thing, getting this, this profession actually, kind of validated and licensed and regulated to be safe for people. But then they really were very anti-competitive and didn't have a growth mindset at all, And so for decades, it was extremely hard to get licensed here. I mean, and it still is more difficult compared to neighboring states, and it's still a lot more expensive compared to neighboring states, which is something that, the board, the more current board, has been working on modifying things, but you have to do things a little bit at a time. And so it's been a process, but
those big processes, it's like turning a cruise ship, right? Like you can work and work and work and work and work. And you're like, we totally changed it. We're pointing 5 degrees left of north now. It's like, congratulations. Yeah.
Exactly.
So what were some of the hurdles, like back when you or your husband got licensed, like what were some of the hurdles that were in place that you guys have just couldn't believe, like this was how things go in the state?
Yeah, it was interesting because we both went to school in California and we got licensed in California first. And then the process coming here to get licensed was just so different. The board was very small. There was one kind of administrative, executive director that was handling everything for the board. And not that they had a huge number of applicants every year, but they only offered the test 2 times a year. And the process, like we had to do our background check with doing actual ink fingerprints instead of a live scan, which California had already been doing a live scan fingerprint for years. So the background check took, a really long time to do versus doing the live scan. That was like one element of it. Then the fees, the actual application fee was like more than double the cost of California. And then
which is saying something, because California likes to lead the charge on high fees.
Most expensive. They charge high fees too. So it always surprises people that we're even higher than California because they have the reputation of being expensive for those things. But they also, at the time, we have a national licensing body, and then individual states make their own laws for their licensing. So at the time, we had to take 2 sections of the 4-section national licensing exam before even applying in Nevada, which that was different than California. California had its own licensing exam. It didn't even use the national boards. You didn't have to technically take them. And then other states would just have you take all 4 of the nationals. You send in your proof that you're licensed and all your educational stuff, and pay, $75 in Utah, I think, and you get a license. Like it was just a very streamlined process, where here it was like all these different steps. And at the time, Nevada, in addition to those 2 sections of the national to apply, they also had their own state board exam. So then we had to pay another fee to take the state board exam on top of the application fee, which doubled the price. So it was just, it ends up being like a big financial hurdle, especially when you first get out of school and you're broke, and it's a big deal. Yeah. So the whole process took a long time.
Did you have to take the test up in like Reno or Carson City?
No. So that's another part that's very funny, is at the time, now they have the test proctored at like a testing center.
Yeah.
At that time, the executive director of the board literally met us at a public library, and we were told to run to the back, like study rooms, to claim them for the morning. And it was just it was a mess. And then, of course, those study rooms at the library, you only have so much time to hold them. So like midway through, they had to move us to another, you get interrupted in the middle of taking your test, to get moved to another section to hold that for a while. So That's funny. It was pretty funny. And the test itself was really quite strange. I mean, there were many questions. My husband and I both left there feeling like we had no idea whether we were anywhere near passing, because there were so many questions that we didn't even understand what the question was trying to ask. It was really clear that like one person had written the test. Like it hadn't gone through a process at the national level and in California there's this whole process of many like committees of people coming together to create the test, and they've got multiple versions of it. And,
Yeah.
it's
Like,
all
not here.
computerized, and like, it was not like that here, but we're talking, this is back
That's
in
funny.
2013. So a lot's changed.
Well, when I got licensed in 2007 in Nevada, the test was only offered 4 times a year. You had to fly to Reno to take it
Hmm.
on site at the basically the conference room at the board headquarters. It was certainly not digital. It had been photocopied so many times that, like, when it like turns a little bit
Yeah.
and like words were getting cut off on like the top left corner. And I had to go to the like proctor, like, sorry, what is this? Do you have any other tests that show this? Because I can't figure out what the question's asking. And she's like, oh yeah. And I think we filled out a Scantron, if I remember, but it might have been a written test. Anyways,
Yeah.
I was just like, why are we making people fly? And the fact that it's only 4 times a year, it's
Right.
not just that it costs this, it's not just the fees and that you're broke at the time because you're just out of school. It's the time it takes. I mean,
Right.
you get it wrong. It's like you have to have your application in about a month before you can take the test. If you miss that one and you roll 3 months later, it's not like you
Right.
can, oh, I'll take it on Monday. Nope.
Right. Yeah. And ours was every 6 months. So if
Yeah.
something happened in that process, you're waiting another,
Right.
you end up waiting a full year. So it was really pretty insane at the time.
Yeah.
Yeah.
Well, along the way, so you made it. You opened up your office. I'm sure there have been no headaches, and it's just smooth sailing to a large integrative office with multiple providers. What are some of the lessons you've learned, whether at the state level or with running? You're running a group acupuncture in a state in a city that was that you were it, right? You were the only ones. What lessons did you learn along the way, and things that surprised you, or even things that went well?
I think that because I had had the experience when I was a student of working in a private practice in California that was a large group practice, and I liked that community of
Mm,
having, and Mike and I, my husband and I, have that built in because we're married to each other, and we both do the same thing. So,
hmm
we at least have that. We can talk shop and stuff and lean on each other. But we also, with it, us being the two of us, and it's our only source of income and everything, I thought, man, it would be really nice to practice with multiple people so that, if we want to take a vacation, if we, we just have like the support of other providers and have that kind of, I don't know, almost like collegiate environment where we can,
hmm
talk cases and bounce ideas off each other and that kind of thing. But nobody was really doing it. But I did have a bit of a roadmap because of having had that experience working in an office in California that did it.
hmm
So it started out with just the two of us, and we actually rented space in a chiropractor's office was how we
Yeah.
got started because we didn't have, any money to get started renting, our own space. So at the time, I actually answered a Craigslist ad that she had put out with like a room for
Wow.
rent in her office.
Yeah.
And that turned into a wonderful relationship. We still are like close friends, and we rented from her for 7 years, I think. Like we
Just a
ended up,
single room, or
no, we started out with just a single room, but we ended up having, she had another room that opened, so then we had two, and then a couple years into things, it was clear that that was not going to work for us. We were busting at the seams and working so many hours just to try to accommodate the number of patients, with both of us just basically seeing one person at a time. So we did a remodel on that office just to make better use of the square footage. So
wow.
then we had 4 rooms. So we each had 2 rooms, which worked okay again for another, year or so. And then we ended up opening a second location to expand like
hmm
the availability of appointments and kind of expand. We had a lot of people driving. We were in the northwest part of town, so some people were driving quite a ways to get to us too.
hmm hmm
So we had the 2 locations going for quite a long time. And then during COVID, a couple of my providers were just doing like consultations on telehealth from home. Like they didn't feel comfortable coming back into the office as early as Mike and I did. And then Mike stayed home with our son. He was really young at the time. And so I was trying to cover both locations by myself and kind of running myself ragged. So at a certain point, I decided, let's just consolidate to the one location. And we expanded at that location. So that's the one that you have come to that you've seen, is that our suite is really large now. And we have 11 exam rooms, but I rent 2 of them. So I have a massage therapist that's there that does like medical massage. And then there's a naturopathic doctor that rents the other one. And then we use the other 9 for acupuncture.
And for the audience, how many acupuncturists do you have? How many staff members, like admin and all that?
We have 4. Technically, we have 5. One of our docs just moved to the East Coast. So she's still doing some telehealth consultations for us, but she's not seeing patients in person anymore. So then there are 4 of us that are there in person. 3 we consider full-time for us, and then 1 part-time. And then I have 4 full-time staff as well.
Okay. So, yeah. And what do you think you could handle with that kind of setup? How many docs could you have working out of there?
We definitely could have more, and that's always the plan, is to expand. But I focus most on finding the provider that's the right fit for our office, that does the same style of acupuncture, also has the right mindset and attitude. And we have such a great team of people, for the providers and staff. And so I really don't want to disturb our ecosystem too much. So it's really, I've been very picky over the years about who we bring on. But we definitely, right now, I could have another full-time, and probably even more than that, the way that we kind of have our shifts. We kind of split the day up into shifts. And right now we're not open on Saturdays, and we're only open half days on Mondays and Sundays. So there's a lot of room for growth still, that we hope to have happen within the next couple of years.
Imagine a practice where patient engagement is seamless and unified. With trust-driven care, connect with patients across text, email, social media, and Google Business Chat, all on autopilot. Empower your team to step in effortlessly and engage in real time from anywhere. Say goodbye to multiple software and hello to a simplified practice and life. Trust-driven care is the all-in-one solution to save time, boost revenue, and build patient loyalty. Book your demo today and watch your schedule start to fill up. Now, back to the show.
I was just telling somebody I consulted with this chiropractic office, and I think it might be the most highest revenue per square foot. So the first appointment you can get on their schedule is at 4:30 a.m. And so that's like the marathon runners, the Ironman, like all those crazy athletes that are up early doing miles. And the last appointment's at 8:15, so they close at 8:30. So they're open seeing patients, and they don't take a lunch break. But what it allowed the owner to do is he has different shifts of chiro. So there's like the early morning, the kind of midday, then the evening crew.
Yep.
So he's using the heck out of the place. And I was like, wow, man, you're going to wear the carpet out faster than anybody else in our industry.
We do the same thing. It's interesting to hear that, because we're open 8 to 6 Monday through Thursday, and we do the same thing. We split the day for morning, midday, and evening, and it makes a really nice balance for the providers, because we're definitely high volume for our industry, and so we have found over the years that I would rather work a shorter number of hours and see more people than work a really long day. Like we've kind of come up with systems to accomplish that, just to give better work-life balance for the providers. Because I want to retain everybody for a really long time, And actually all of my staff, everybody's on a 4-day work week too.
Oh, nice.
So that the balance part's real important.
Yeah. I would love to talk about that, because, I was just talking to another provider that came to our live event, and she had a bad fit member of her team, and so ended up firing them. And it was kind of a topic of discussion, but we talked about hiring. And I think hiring is one of those things that we throw out and we forget how expensive it is, both in time and money, to get a new fully licensed provider up to speed with your systems and understanding, and get them integrated in your staff. And I'm like, yeah, you're probably, as an owner, spending $20,000 to $25,000 on the front end, not including their salary. Like obviously their salary or their pay is going to be higher than that. I'm saying just the cost of your work, finding them, interviewing them,
Right.
training and all that stuff. And I think that often goes unnoticed. But how did you end up at the 4-day work week? Was that just because you're like, I like 4 days and everybody else should too? Or did you get some complaints early on or what?
No, not complaints. I mean, it was really based on just my own experience. Because early on, when it was just my husband and I, and then we had one, like when we brought on our first staff member, I just we were so stretched trying to meet the demand because there's so few acupuncturists in Las Vegas that pretty much everybody within the first couple of years of practice, you can be very busy here. You know, you can be as busy as you want to be. For me, I really realized it when I got pregnant with my son. I just physically, I got to a point where I could not work as much as I was working. So it sort of like forced me to rethink how we were doing our schedule, you know? And then, so I went down from working, you know, like 6 days a week to 5 days a week. And then we got to a point where I'm like, man, it would be really nice to work 4 days a week.
Right.
And in all honesty, now for the providers in our office, it's really more like 4 half days a week because they're not working like an 8-hour shift. We have that, you know, the day is divided into these like 4-hour chunks basically, and with not much overlap with each of us. And so I do more hours than that because I do all the admin stuff. You know, I'm the director. So there's also a ton of other responsibilities that I'm taking care of on a weekly basis. But
all the ones you get the most pay and most glory for, you know, they're really highly appreciated. Yeah.
I do feel appreciated by my team, but yeah, that's the unpaid work that goes on in the background that keeps it all running as smoothly as possible. And I do feel proud that we have a pretty well-oiled machine at this point. I mean, I think I drive everybody a little bit crazy because I'm always trying to tweak the systems to make things the most efficient that they can be. And, you know, this is how I came to trust-driven care because I saw that, oh man, this could really offload some of the time that my staff is doing certain tasks. We could have this software doing this thing, you know? And
I think that's a common, you know, a lot of people are like, oh, I'm going to use this to market and like grow my practice. And I think that our biggest users are always like, how can I turn those same ideas internally to make it more efficient? And if you think about like admin and healthcare is often these people that are thrust into a completely disorganized thing where every mistake is a crisis. And think if you were that young 21-year-old working the front desk, it's like, is that the kind of thing you want to be part of? And usually they believe in the mission. They're like, hey, I believe in acupuncture. I see patients getting better, and that keeps them there. But the disorganization just tears them apart. And man, I see it so many times. And the flip side, when you organize and standardize your process, so like my dentist, it's clear that they have great systems in place. And I've been going there for 7 years, and it's always the same 2 people at the front, which, you know, I mean, 7 years to keep a admin in healthcare is like, you guys are doing something well. But my gut instinct is they're not forced to problem solve every hour of every day. It's like run the system. You know, Rachel will step in and improve it when you need to, but otherwise just run it. What have you learned in improvement? Like, because the other side of that is, for those listening, I'm not saying to change everything every time because that will also drive everybody crazy.
Yes, that's also, I do less of that these days. It's small tweaks these days, but it was trial and error for sure. You know, the first
what were some
few
things
years.
you did automate or standardize that really you feel like connected with your staff, made their lives better, easier, or produced a better result for the patient every time? Can you think of any specific examples?
Yeah, I mean, the way that we run like the flow in the office, I think has improved for us a lot over time. We have a system now where the evening before the following day, the back office staff will print out the schedule for the following day, and every patient gets assigned a room. And that task takes a little bit of time because they go into each person's chart, and we use Jane app for our practice management software. And there's a little alert system you can use in there where we put down notes about the patient. So for us, it's which direction does the table need to be set up? Are they treated supine or prone? And then we also have things like if they need a pillow for under their hips, if they need a sheet to cover with, if they like the table warmer turned up really high. Like we have all these kind of little details about each person that we keep track of.
Like the Ritz-Carlton of acupuncture here, right?
we
like,
we really try to be like patient experience is the number one, thing in our office. So the back office staff does that the night before. So they're writing down, they're assigning room numbers, they're putting the up and down arrows of directions of the rooms, and then any little notes that we have. So then in the back office, we have a copy of that hanging on a board, and that's kind of our touchstone all day. And the front also has it. So when they check a patient in, then they're collecting payment or whatever. That was something that we also changed. We get all of the front office stuff done on the front of the appointment versus on the back end of the appointment when people are like dazed and confused after they've just relaxed for half an hour.
Yeah.
They come out kind of super relaxed, and sometimes your executive functioning is not online again yet. But so they check the person in and collect payment, and then they send them to a room. So when we're kind of onboarding new patients, my assistant will go out to the front and collect them on their first appointment and explain our whole process. So they're sort of giving them this little download of, okay, when you come in, the next time you check in, the front desk staff are going to just tell you which room to go to. And they give them a little like tour. Here's what the office looks like. All the rooms are numbered. Hit the restroom on your way in. It's easier to relax if you don't have to use the restroom. And just sort of trains the patient on what our process is. So nobody's like confused coming in. And then they get the patient in the room, and that makes it, some of the patients, we're going to tell them to get ready right away, and we'll just chat while we're doing our thing. And then sometimes we want them to sit and wait and talk face to face for usually the people that are newer, we do that. So we have it's very systematized in that way. And everybody between the front and the back office, everybody's all on the same page about how that whole thing goes. And then when someone checks out, the front desk is marking them off, and they're helping turn rooms over in the back. So it runs pretty smooth. We, barring crazy traffic things happening and a bunch of people coming in late back to back, we tend to run very on time, which is also very important to me. I hate when I go to a doctor's office and I've made an appointment at 8:30 and I don't get seen until 10, or 9:30. It drives me crazy.
That's the number one complaint in negative reviews of healthcare providers is always timeliness.
Yeah.
I sat and waited, blah, blah, blah. It's number one is timeliness or lack of timeliness. And number two is rude staff.
Yeah.
So you've improved, you've eliminated both. Congratulations.
Thank you. It's been a process. I mean, we've definitely had times where we've had to let staff go that just were not kind of fitting the vibe of the office. And I always want people coming in to feel like we've known them forever when they walk in the door, like they have that very like warm welcome, putting them at ease, making them feel comfortable. And not everybody's personality aligns with that. We've had times where we've hired staff and it seemed like that was going to be the case. And they seemed, bubbly and friendly in an interview, but then it's a whole other thing when they're trying to multitask and they've got other stuff in front of them. Then sometimes it's hard for them to prioritize having that kind of interaction with the patient. So, we've had to have difficult conversations and then sometimes let people go because it just wasn't a good fit, But.
Yeah. You have been through the live event. So we talk about this I think we don't, as healthcare providers, always realize like when our CPU, our little computer's running upstairs, how sometimes we will seem cold and unwelcoming and our body language is like, I'm not really excited that you're here, Rachel, but go ahead and tell me what's wrong. And that feeling in the visit. And to us, if you asked us, we'd be like, no, I can't remember anything about it. It was probably fine. And the patient's like, no, that was horrible. Like I didn't feel supported at all. And, having systems and processes in place is the insurance against that is that every time you enter every single patient visit, you can be the authentic person they connected with at some point in the last 10 visits, but you can be the highest version of that every time, you know?
Right. That's
it's
always
hard.
the watermark
so
we're going
hard.
for.
Yeah.
Well, and it was something when I came to the live event, I loved that we came into it thinking that it was going to be learning about the software, which it was, but so much of it was really that patient experience piece. And I've spent a lot of time, thinking about these things, and it's been such a priority for years for me that before the live event, I wouldn't have thought that I had like a ton of different areas to improve upon. But then when we went through, some of the different activities that you had us do, and it really highlighted, oh, wow, there are some areas where I could improve and the staff could improve. And we just always need to be working on always doing a little better, for people. So
is there anything specifically you guys have really that highlighted and you really focused on since? I mean, when I walked into your office, I was like, it exudes that you guys get it. It like, I hadn't even got to the desk and I was like, I already feel comfortable here,
Oh, okay. I'm so happy to hear that.
Yeah. And then everybody was engaging. Like, it just felt like a comfortable place to be with. And I can imagine my third time there when I knew everybody would even be better, that just,
yeah.
So I'm surprised to hear you say like it highlighted things that you need to work on. I think you're like, you guys are already in the top 5%, maybe top 2% of all healthcare clinics nationwide. So yeah, but what came up?
One thing that came up that sounds so silly now, but we never had staff wear name tags before. And so we changed that. I ordered everybody a name tag after we went to your event. And I realized I just went to an office recently, and I've been going to this office for, I don't know, a few months now, fairly regularly. And the staff there are all very nice, but I don't know anyone's name. Like, no one, when I first did, I know the provider, but all the staff, no one ever told me their name. And then now I feel a little rude asking, because I've met these people all multiple times. And the last visit that I was there, the front desk gal was telling me, like, asking to do a Google review. And she said, oh, by the way, we're doing, if you mention a staff member by name, then the owner's going to give us a little bonus. And so she's like, so yeah, definitely mention me by name. And I thought, oh my gosh, but I don't know what your name is.
Just the lady at the front is very nice.
The lady at the front is very nice. And so that was one definite, like, we were like, pounding our forehead, like, why did we not think to do this sooner in my office? So that's something.
Was there some resistance from the rest of the team who didn't go through the event? Everybody was down? Okay.
No, everybody was down. And we did at our next staff meeting after we came to the live event, I actually ran my staff through a couple of the exercises that you had us do at the event, which was, everybody loved that. It really highlighted things really well. But I think it's been really interesting with the name tag thing, because I do think it's helping patients to feel more connected to the staff. Like, I noticed the patients using my staff members' names a lot more than in the past,
Interesting.
And I think they would often compliment me on how nice a staff member was, but they would never know what the person's name was. Like, oh, the girl with the curly hair at the front,
Yeah.
Even if they'd been coming in for a little while sometimes, so that's been interesting. It's just one more added layer of connection. It's nice to call someone by their name and to know someone's name. It adds that, level
and
of
I think
personalization.
It's not in allied health, it's not as distinct. Like, you're usually working with the provider very quickly from when you get placed in the room.
Right.
But in some professions, I mean, like, I'm sure when you were pregnant with your kid and you go to an OB/GYN, there's the person taking your blood. They're not the nurse, right? But then the nurse comes in, and then there's the OB/GYN, and then there's the PA, and you have all these different people, and you're like, the ability to reference, like, what is your role? Because I went to this, I recently had an appointment, and this woman comes in and she's like, yeah, I'm going to take some blood and run some numbers. And I was like, great. Are you the doctor? And she like looked at me. She's like, no, I'm just the medical assistant. And she was so offended almost that I was asking. And I'm like, I'm just trying to like place you in my map.
Right.
So then a guy comes in and he's like in, scrubs that are like, the light blue, like scrubs have an inverse relationship. The worse they are, typically the higher ranking the person is. You know what I mean? Like that's my little thing about scrubs. But anyway, so he comes in and I'm like, he's doing something and he doesn't introduce himself, goes right into, hey, can you do this and this and this? And he's poking around. I'm like, okay, are you the doctor? And he's like, no, I'm just the nurse. And I'm like, what is it with people being offended in this? Like, I'm just trying to figure it out. And then finally, this woman comes in. She's also in scrubs. I'm like, sorry, are you the doctor? And she's like, yeah, I'm doctor, whatever. And I'm like, thank God. And she's like, what's the problem? And I'm like, and now I'm like, oh, you think that because you're a woman, I'm thinking you're not like, I think her perception was I was being sexist, but I was just like, the third time, can somebody freaking tell me your role? Please,
right.
God.
Tell me who you are. Yeah.
Right. And what you do here. And it's fine. I don't care what it is. But if I know you're Rachel, the acupuncturist, this is Stacy, the, front desk coordinator, totally fine. I just want to know. I just want a little reassurance as I'm spinning up with all these things in my head. So it's just.
Right. Yeah.
Yeah.
Yeah. The other thing that I really took away from the live event was I realized that I was interrupting people talking. And I think with good intention, I was trying to like clarify something they were telling, something I had seen in their paperwork that they had filled out, or trying to get to the bottom of whatever issue they're coming in for. And so doing the exercise that we did with having each other speak for 2 minutes and just see like that was very eye-opening for me, because I realized like, wow, I really am interrupting people so quickly. And it's with good intent. I don't mean to like talk over them. I'm trying to understand, but I realized that just letting them say their piece for a couple of minutes and explain the whole thing, then I usually get most of the information that I need. I don't need a lot of clarification if I just let them talk.
Yeah. It's great to hear that. And I hear that all the time from people, because I think you're right. Like whether it's in a personal relationship or not, I think us interrupting and trying to clarify is me saying, I know you're in pain. I see you're in pain. I want to remove the pain as fast as possible. But we also forget that human just wants to share the emotional piece with us.
Right.
And it often makes a huge difference, we hear in the weeks after. But can you think of a specific case where you listened? And I've found sometimes when you get past about a minute, every once in a while, you'll hear an absolute doozy in that second minute. And you're like, whoa, I wasn't waiting for that.
It happens on a fairly regular basis that patients will fill out, or when they call and my staff books their appointment, they put notes in the appointment about what the patient said they were coming in for. Mm-hmm. And then the patient fills out their paperwork online. And sometimes those two things don't match. Like what they told the staff they wanted to be treated for is different than what they filled their paperwork out for. I just had somebody yesterday that they said low back pain when they booked the appointment, but then when they filled out the paperwork, it was neuropathy. I'm like, okay, so what are we doing? So then coming into the room, I just, introduce myself and say hello, and then ask like, how can I help? What can I help with? And then just see what comes out. Is it going to be the low back pain or the neuropathy? Or sometimes it's a little bit of both, but that happens multiple times a week, I would say, where someone, when they book the appointment, they might say one thing to the staff, but then when they get to filling their forms out, maybe other things come up and they decide like, oh, I didn't know that I could be treated for that. And, so that's helpful, because then I'm not walking into the room with a preconceived notion of like, okay, let's work on your back. And really what they want to work on is their neuropathy, but I steer them toward working on their back, so I think that's been really helpful.
Yeah. How about, has anybody revealed a red flag that was kind of like hidden, and then, late into the conversation, you're like, oh, wow. I had a guy a couple months ago, and, one thing we always worry about with low back pain is chiropractors like urinary incontinence. Right. And he's like, going on and like literally minute 40, right? We're deep into the thing. And he's like, yeah. And it was really weird. The other night I went to bed because my back was hurting so bad. And I woke up at like 3 a.m. and I had peed my bed like a lot. and I didn't even know I did it. And he's like, yeah, then I got up and then I went to the bathroom, but it was like hard to like start. I'm like, oh my God, this is textbook urinary incontinence. So I'm
Yeah.
like, you're getting an MRI. That's like step
Yeah.
one, you know?
Yeah.
But I just thought like 30 seconds earlier, this guy, he was kind of gruff and stuff. He never would have used the words, I'm embarrassed to say it, you know, like even break like that vulnerability of like, yeah,
Right.
I'm ashamed of it, but here's what happened.
Yeah, I know I've had instances like that in the past. Nothing's coming to me in the moment, but I for sure have had, I mean, something that we see quite a bit is patients that haven't been to a medical doctor for many years, like for whatever reason, they've been sort of jaded by the system, and they might be coming in hoping that acupuncture can treat something that's like way outside of our scope. I have that happen sometimes with people that have red flags for cancer. And when I was an intern in California, I worked for a year at the San Diego Cancer Center.
Oh,
So
wow.
I got accustomed to kind of seeing those, those red flags. And so there have been multiple times over the years where I've said, you're not in the right place. Like let's get you referred out to, get you some testing and see what's happening here.
Yeah.
And I had a gentleman probably last year that hadn't been in to see a medical doctor for, I think, like 35 years or something.
Wow.
And he was in like late stage congestive heart failure. And just so we ended up being able to get him to go see a cardiologist and get on some medication. And then he felt so much better. He was, like very thankful that he
Yeah.
had done that. And that may have been one too, that he had filled the forms out for something, like he wanted to come in and get treated for pain in his back or something. But then we started talking and he's got shortness of breath and his legs are super, edematous. And he just had like every hallmark symptoms. So I'm like, okay,
Yeah.
before we work on your back, let's make
Yeah.
sure that you get this under control first.
Wow. Yeah, I've had that as well. And I think it's one of those times where you want to make sure that I appreciate the trust that they're putting in me.
Yeah.
And I'm like, I'm glad you think that I'm this good. I'm not that good. Like, I'm not good with cancer. So I'm not going to, but in their eyes, it's like, well, you treat my back pain and my foot pain. So why not this other? And you're like, well,
yeah.
But they use you as that filter, that trusted person to guide them,
Yeah.
No.
Yeah. And I mean, I take that responsibility really, really heavily. So appreciate them putting that trust in me. So I always want to make sure it's about doing the best thing for the patient,
Yeah, for sure.
Yeah.
And those cases, I wouldn't say fun, but I do think that when you get the patient experience right, we forget of how rewarding and fulfilling and fun it is.
Yeah.
When you blow their minds, like I was at Disney World one time and I remember seeing this older guy, they have the marching band that goes like down the street. And this guy, like his trumpet, like you could see there were spots that were essentially worn through. He'd been playing the same instrument, I bet, for 25, 30 years, right? Maybe more than that. And so we're doing the hot dog dance, hot dog, hot diggity dog.
Yeah.
And afterwards I go, hey man, it looks like you've been playing for a while. Does it ever get old? And he's like, sometimes. But when I see those kids over there dancing the hot dog dance, he goes, I remember why I took this job in the first place. And I was like, oh, that's so cool.
Yeah.
And I think some of us, we get the pressures from insurance or costs and pre-qualifications and then getting licensed and all the different things that come along. We forget why we even set out on this journey at all.
Right.
And we want to help people. That's why we're in this practice of healthcare.
Yeah. And the more dialed in you get with connecting with the patients, the more you get that feedback of this is why I'm doing this kind of thing.
Yeah.
It does help to balance some of the stress.
Yeah.
I call it my attitude adjustment. Like sometimes I'll be dealing with some insurance issue in particular because we take insurance. That's the biggest headache of my practice, I would say. And it can be so frustrating. But then as soon as I walk through that like exam room door and they're with connecting with another person and getting to feel helpful and, feel like I'm doing something rewarding and helping them get out of pain, then, it's just easier to kind of like, okay, I got to deal with this insurance thing, but it's all worth it in the end because this person is going to feel so much better, at the end of the day.
And when it happens, man, it's fantastic. It's like before we started recording, we were talking about some parenting moments. And I think same thing with parenting. When you see them do the thing, you're like so rewarded. But sometimes the journey between here and there, it's like
the getting there can be a little rough. Yeah.
Yeah, exactly. Well, Rachel, this has been a fantastic conversation. I certainly have enjoyed it. If people want to check out your clinic, can you throw out your website for everyone?
It's www.integrativeacu.com, and that acu spelled with just one C, ACU. All of our social media handles too, like Facebook and Instagram, are both at Integrative Acu. And yeah, they can go from there. We've got a lot of info on the website. We're in Las Vegas, in the southwest part of town, like near Russell and 215 area. So
yeah,
we'd love to see you.
The other side of the world from me. I'm way over in Henderson.
Yeah,
which
I know I get many patients that ask, when are you opening a Henderson office?
Yeah, it's an inside joke to everybody listening because everything in Vegas is like 20 to 30 minutes away from each other. Like you can't be that far away from anything. It's so close, and that we treat a 20-minute drive across town as like monumental. Like, I would only drive 8 minutes for healthcare.
We're all very spoiled here in Las Vegas with the traffic for the size city that we are. Yeah. We are very spoiled. You can really get from one end to the next pretty quick.
Yeah, and our airport is like dead center of town. So when you have to fly or travel, it's not like you're driving
way outside of town. Yeah.
I don't know if you ever flown into Denver, but they're stretching the term Denver for Denver International Airport. It's nowhere near the city of Denver. Yeah. Yeah. Anyways, well, Rachel, thank you so much. I really appreciate your insights. And I will say your practice is so great and is just so much about the patient experience. I never even went into a treatment room and I felt better just being there. So what you're doing is working.
Thank you so much. I really appreciate the compliment, and I, thank you for your whole mission with Trust Driven Care. And it's such a great software. I mean, we haven't even really cracked the surface on all of the things that software can do. And it's already made such a big difference for my staff and the patient experience. Just as one quick example, we have the happy birthday text going out, which is a really cute little funny GIF, and people love that. We get so many replies from the patients, just like, "Oh my gosh, this was so amazing," or "That's the cutest thing I've seen," and it's just a fun little way to connect with people and keep it human,
special.
Yeah,
I was laughing. So you came to the live event, and what was it, September or something? And my birthday's in November, and I got a message on my birthday that was so dry and so bad. And I was like, I wanted to text look at this garbage. Like, this it's like, don't.
Here's an example of a bad one.
Yes. Yeah. And I was like, please forget my birthday because this message is so bad. But what is the GIF of you guys? Are you dancing with a banner or something?
We are. So Dwayne had done it for us at the live event. So it was my colleague Karen and I in it. And I think, we both have little hats on and banner. And we're kind of dancing, shaking the little banners around it.
Yeah. People absolutely love it. You're right. And it's great because it's something special on their birthday,
Yeah. Yeah. And when you do it right, the patient loves it. I know that I get all of the really dry, sort of not great ones.
Yeah.
So could probably make a list of potential clients for you for Trust Driven Care based off of the messages that you get from other providers.
Yeah, that'll be our Facebook ad. Are you sending out really bad birthday messages?
The idea is there. It's just the execution. So yeah.
Well, thank you so much, and really appreciate the fact that you're implementing these things, because between the 2-minute drill and the name tags, all those things in the bigger picture really are creating a better healthcare experience for people. And that's you guys should be commended for doing that. So, and you're a great implementer, man. You go to one event and you're just like, here we go. We're changing, we're improving. Yeah.
Well, thanks for helping to change healthcare one office at a time with trust-driven care. So
absolutely. It's our pleasure. On behalf of Dr. Rachel Kohl, this is Dr. Josh Satterlee saying, follow Rachel's lead, build trust with your patients, and you'll be impressed by the outcomes. Thanks so much, Rachel.
Thanks, Josh.
Thanks for tuning in to this episode of Trust Driven Insights, brought to you by Trust Driven Care. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of trust-driven care. If you're ready to streamline your practice, check out trustdrivencare.com and see what's possible. Trust-driven insights, real conversations, smarter care, stronger business.